The first cranial nerve is the olfactory nerve, and testing it is by aromatic substances. First, instruct the patient to close their eyes and occlude one nostril. Then present a non-irritating, familiar odor to the nostril and ask the patient the following. Do you smell something? Can you identify the smell? I smell alcohol. And what are the findings from this exam?
This is intact, left and right.
Abnormal findings may be the result of an obstructed nasal passage versus nerve damage, and the loss of smell is usually unilateral with a developing frontal lobe meningioma. The next cranial nerve is cranial nerve 2, the optic nerve. This is confrontational visual fields.
And third, this is four-finger counting.
The next test is pupils, which assesses cranial nerves 2 and 3.
Pupils are equal, round, reactive to light, and accommodating, minus APD, ODOS.
The next test evaluates the extraocular muscles, evaluating cranial nerves 3, 4, and 6.
All right, the EOMs are full range of motion minus restrictions, ODOS.
The next test measures cranial nerve 5, and it's a measure of corneal sensitivity. First, have the patient without contacts look up and away from you and approach them from the other side with a fine wisp of cotton. And make sure you avoid the lashes or conjunctiva. Stimulation. Compare the promptness and completeness of lid closure and ask the patient for subjective comparison.
It felt about the same.
Intact and equal OD and OS. The next test is facial symmetry, which assesses cranial nerve 7. First, inspect the face at rest. Observe the corners of the patient's mouth. Mild asymmetry may be normal, but dropping of one side of the mouth, flattening of the nasolabial fold, and sagging of the lower eyelid suggests weakness of the facial muscles. Occasionally, the face is pulled towards the normal side. Then observe the patient facing you and look for a difference of each side of the face. Record if both sides are symmetrical.
Intact and equal, left and right.
The next test is the hearing test, which assesses cranial nerve 8. Standing behind the patient, have them close their eyes and cover one ear. Instruct them to indicate when they hear the sound on the uncovered side. While moving your arm in towards the patient, rub your finger and thumb together, creating a soft noise. Approximate the point when the patient hears the sound. Then you repeat on the other side. The sound should be heard from an equal distance in each ear. If not, this is an abnormal response.
Yes.
If the test is abnormal, then you can determine if the loss is neurologic or conductive by performing a Weber test. Record intact and equal right and left if it is normal.
The next test is vowel pronunciation, which assesses cranial nerves 9 and 10. Listen to the patient's voice, and if the patient is hoarse or complains of a voice disturbance, test the vocal cords.
Hey, Yeji, I want you to say the vowels.
A, E, I, O, U.
Good, they're intact.
The next test is a shoulder shrug and head turn, assessing cranial nerve 11. Test the strength of the sternocleidomastoid by having the patient try to turn their head towards one shoulder, while the examiner resists this movement. Repeat on the other side. Then the trapezius muscles are elevated by having the patient shrug their shoulders, while the examiner attempts to push them downward. Palpate the trapezius muscles for atrophy. Look for symmetry between the shoulders while at rest. Record intact and equal right and left if normal. The last test is a tongue twister, which assesses cranial nerve 12. Have the patient attempt to pronounce a short 3 or 4 word statement that elicits a high degree of tongue motility. If there is a problem with tongue motility, then word pronunciation will be affected.
All right, Zach, can you tell me a tongue twister?
Sally sells seashells by the seashore.
All right, it's intact.